Unmanageability. Unmanageability. This is page 9, chapter 1, ACoA workbook. Unmanageability. Unmanageability. Like powerlessness, the concept of unmanageability in step 1 is often misunderstood by adult children. While some of our families were chaotic and unstable when we were children, many homes seemed manageable and productive. But we learned that productivity does not always equal a manageable, wholesome life. For many of us, what we thought was manageable or desirable in our dysfunctional homes was actually oppressive control. The unmanageability that we speak of in step 1 involves our desire to control others and ourselves while having a sense that we are not capable or effective. While we have moments of control, we usually experience painful episodes of losing control. When we feel hurt when confronted by our loved ones for our controlling behavior, they act out in anger or abandonment to disrupt our attempts to control them. We may be momentarily hurt, but we usually blame others for this abandonment. We blame them for not reading our minds or not acting in a manner that we would approve. We run about attempting to control others and situations in an effort to avoid our own unmanageable lives. Control is an attempt to minimize uncertainty and to avoid our own uncomfortable feelings about the past and present. Yet, our unmanageability, fueled by our fear-based control, inevitably creates what we fear most: abandonment. Many adult children, whether they are a newcomer or a member who has worked another 12-step program, miss the subtle distinction between powerlessness and helplessness. They miss fear-based control appearing as manageability. The ACA experience has shown that adult children will cling to controlling behavior and learn helplessness as long as it works for them. However, these learned behaviors can be challenging with diligent step work and regular attendance at ACA meetings. Lastly, any discussion about ACA powerlessness and unmanageability is incomplete without the disease concept of alcoholism and family dysfunction. When alcoholism or other dysfunction is present in the family, every member of the family is affected. We are affected in body, mind, and spirit. Through the first 18 years of our lives, our families had 6,570 days to shame, belittle, ignore, criticize, or manipulate us during the most formative years of our being. That is 1,600,000 hours of living in dysfunction with unhealthy parenting. That is 72 seasons of sorrow, sewn deeply into the tissues of our body. The dysfunction is encoded into our souls as the false self. To survive this long exposure to family dysfunction, our minds developed deeply entrenched roles and traits that changed the meaning of words and experiences. Some of us misremembered the damaging nature of the abuse because we depended upon our abusers for food and shelter. As children, we did not have the option to leave our homes. If our parents slapped us, molested us, or neglected us, we had to live with them. We had to figure out a way to survive. The subconscious survival decisions we made as children involved changing the meaning of words. Because we were vulnerable, we changed the way we perceived the emotional and physical abuse. We feared for our safety or feared we had caused these things to happen. We developed stories that minimized our parents' behavior, or which convinced us that we were wrong and deserved their harmful behavior. We came to believe that we deserved to be hit or criticized with brutality. We confused molestation for love because the person molesting us was a relative, describing such actions as love. Such confused thinking about hitting or touching fueled our denial as adults. The confusion allows many of us to say we had normal childhoods when we have lived through hell. We never spoke of family secrets. We thought we'd forgotten the abuse, but the body and the mind remembered. The survival traits we lived by showed a clear path of our terror, of abandonment, and of being shamed. During these years of family dysfunction, our inner child, or true self, went into hiding and remained heavily fortified under addictions or dependent behavior. This is what we mean when we say the disease of family dysfunction affects us in body, mind, and spirit. The disease survives in the language of denial and is passed on to the next generation through secrets, blame, and confusion. The disease of family dysfunction is progressive, incurable, and sometimes fatal. The disease becomes worse over time unless it is treated. However, the malady is often misdiagnosed, causing the adult child to seek remedies that usually fail to bring true relief. Many adult children have taken their own lives or died from complications of drug addiction or physical ailments that can be traced to childhood abuse. These are stark claims, but we have found them to be true in our experience. This is the dire nature of the family disease of dysfunction and its great reach. But there is much hope in ACA and in sharing our pain with other recovering adult children. We urge patience and gentleness when addressing these areas of our lives. That means we take care of ourselves. We do the step work and the program work necessary to reap the benefits of the ACA promises.